Hearing loss in children. Wow, this is very important topics actually. If child don't hear means he is not speaking well, he is not learning well, he is not communicating well. Born with totally deafness, here we have to go for cochlear implant as the only chance to bring a normal hearing to that child, provided that the nerve pathway is intact. When the children gets older, the main cause of that usually infection here. The children getting more infection of upper respiratory tract infection, ear infection, otitis media, and so on. And they usually get something called glue ear, collection of fluid behind the eardrum. We can restore the function of the normal ear through clearing the fluid from behind the ear, and we also do removal of the causes of production or formation of this fluid, which is usually a big adenoid and big tonsils. And of course, there are some children, they are not totally deaf and they are not willing to have the cochlear implant option. They can have also a hearing aid fittings. Some children, they do that. And we have a full section of hearing and speech evaluation with expert people. They can diagnose and see what is the problem, the size of the problem, and what is the best way to deal with that problem. Treatment of the problem, as we said, depends on the causes, and the early detection is the very most important part of the whole thing. We have to recognize the problem at the very early stage. So there is what's so-called preventive measures. Globally, everybody, all health institutes try to follow this. Special immunization program for children. Also moms, before getting pregnant, they have to be immunized, and mainly the teachers and those kindergarten teachers, they have to observe this very early, and of course the families. They have to do that as well. Main things, if we detect this early, we can correct it. So we have to imagine that the hearing is very much important for everybody, but very much especially for kids.